Hello, everybody, and welcome back to our nonprofit spotlight series. Today, we are pleased to be joined by Laura Hines. She is the CEO and director of the Stanford Sierra Youth and Families out there in California. Laura, thank you so much for coming on. And you just recently celebrated 125 years, correct?
Yes, 2025 is our 125th year of serving young people and families in our community in the Sacramento region.
That is incredible. Can you just set the stage a little bit and tell myself and our audience a little bit about what y'all do?
Well, we actually 1800 was when we were founded. We started as an orphanage, and we have evolved from there into a very broad service array, including mental health services, behavioral interventions for young people when they've got a safety challenge, harm to self, harm to others sort of situation. We also do substance use prevention treatment for young people. We do a lot of family building, problem solving, skill building, and communication development for the whole family system. We also find foster homes and also seek out permanency for young people when they need a family they can call their own. Underlying it all, our real focus is that every young person deserves a safe, stable family in which to grow and a family that they can call their own.
That is incredible. And as the organization has grown and changed and adapted over time, the whole ecosystem is a really diverse web of services. What what is your specific piece of the puzzle? What would you say is that kind of niche that you fill within that broad ecosystem?
Our primary focus, it's broad. I mean, when we were an orphanage, it was a safe place for kids to live and make sure they had food and shelter and care. But now it really is focused on stabilizing the family, preserving families as much as possible, but also addressing very high need behavioral and mental health challenges that our young people, 0 to 22 years of age, may face that actually put their own, safety, but also their well-being at risk and impact the whole family system. So we really do whatever it takes to stabilize the young person, support them and equip them with skills and their caregivers and the family system. So it is a broad array of services. If I were to nail it down, it looks different based on our programs. We have 35 different programs.
Wow. And this year has been a tumultuous time for the broad nonprofit ecosystem. There's been some funding constraints, but then also the need that a lot of nonprofits are servicing is also simultaneously growing. Can you tell me a little bit more about internally how y'all are navigating these challenges and especially around funding and what your philosophy is on that?
So it's been interesting because I would say the last several years have been quite precarious for the nonprofit world, especially child welfare
Mm,
and early adult and young people's mental health services. We
mm,
had a huge increase in demand post-COVID for mental health services. We in California were locked down longer than most other states, and we are still recovering from the mental health component impact for those children in specific age ranges. And so our requests for additional services increased pretty
mm.
dramatically. Simultaneously, we also were challenged with finding workforce, staff to deliver services. So there was
Yeah.
an increased demand in services, and then we were struggling to find folks that wanted to go into the helping profession after the community trauma of what we were experiencing for I would say a good 2 years here. And so what we've been navigating since is, for a period of time, I could not grow the organization because I just could not fill my existing positions, and I was stressing my committed tated staff by asking them to do more with less, right? But since then, we've really been able to we've poured in a lot into workforce through a lot of advocacy at a broader level, and folks have come back into the helping profession since, and so we've been able to grow. We've actually doubled in size from 2020 to
Wow.
2025. In our service breadth, now we're serving near 8,000 young people and their families, and also in our contracts. So the other challenge we did face more recently in the last 2 to 3 years has been the increased cost of the workforce, and our contracts didn't keep up with that, so it required a lot of in-depth analysis of what we needed, advocacy back to each of our contractors. So we made some headway there, but also additional requests for fundraising and
Mm,
donor and grant opportunities to augment our financial resources to support the workforce we needed to deliver the services. So it has been a pretty complex time. I would say, I've been in this field 30 plus years. It's always been complex and demanding, but I
yeah.
would say there's so many factors from local to state to what happens at the federal level that all impact how we do our work and how we continue to ensure that our young people are served. And
Mm.
that has continued to actually get more and more complex.
Thank you for that context. And, for our audience that's listening in, either at organizations within this, health and services and human services, but also the broad nonprofit ecosystem oftentimes faces these same staffing and challenges. What would be, a piece of a next action that they could maybe take as they look to maybe tackle that within their own organization?
Well, what I did, I could speak to is I really leaned deeply into our mission. You start with why and really lean into why are we here? What calls you personally to do this work? And then I also recognize, especially as the demands were greater, I had a very committed core team that you really must leverage. When you grow, it can't just be one leader. It really has
Mm,
to be a group of leaders with the same message that are empowering those that work with them, report directly to them. And so you have to deepen that mission focused component, but also draw out their way, their solution to address whatever we have as a problem. If it's referral, if it's staffing in a particular program. One of the things I also discovered is a few of my programs, we had no challenges with our workforce. What's working in that component of our programs that we can learn from to build
mm,
into the other programs that we're struggling more with turnover. So each there was this peer support and leadership that was more deeply developed during our most difficult times. So it's not just one leader, it's you leverage all of us to have the same message and draw out how can we do this better? How can we meet this challenge with what we have? And then also simultaneously focus on that opportunity to bring in more resources. You're navigating hope and you're also navigating the reality of what you have in front of you. And you have to do it simultaneously. That's the demand as a leader.
that was incredible context. I really appreciate it. And we talked a little bit about the 125 years that y'all are celebrating. That's both a time of reflection, time of celebration, and a time of planning for the future. Can you tell me a little bit more about what the future looks like, for the organization as y'all look to the next 125 years? I don't know how long the time horizon is.
We actually discussed this just recently. We do map out these strategic plans. They don't go 125 years. We map them out based on kind of what we see in the way of legislation that'll impact us
Mm,
because there's
yep,
a
of
lot of things outside of our organization that impact how we are able to do our work internally. We also
course.
recognize that the needs of our young people and the communities may change. And how we work with that. But our focus is really deepening what we're best at and magnifying our impact by growing our capacity to serve young people and families with what we do best. And those things for us are really identifying the intensive mental health services, the high need mental health services that some of our young people have, and that deepening and strengthening of the whole family system
Mm,
while we serve the young person. And then elevating, I call it empowering our young people and our families so that they can face the next challenge together when we're no longer in the service array. because they don't stay with us forever, but what you
Of
do is
course.
empower them to move on so the next challenge they can face without you, and then you can serve more families. So you're building and equipping everyone with new skills, and that actually strengthens the whole community, right? And it
Yeah.
also advances, I see this advancing and healing generations to come with the deep work you do with a family and a young person today.
Okay, well, Laura, thank you so much for coming on and sharing more about that impact, and thanks for coming on the show.